Sacco, and this is Bridge Prep. My guest is Christina Houston. She's the founder and CEO of Houston Home Healthcare, LLC, an evolving evolution sleep evaluation and diagnostic center. She has more than 12 years of healthcare experience and business development, and she spent over 15 years in a variety of industries. Welcome, Christina. Now,
Thank
you. Can you tell me, Christina, what inspired you to start two healthcare companies?
Well, I was inspired to start my first healthcare organization due to the lack of quality of care, misdiagnosis, and incomplete patient care I saw when working as a pharmaceutical representative. And one of the continuous questions that I asked many of the physicians that I called on was what was there a need for. And at the time, sleep clinics were definitely underutilized because many physicians were not taught to screen for sleep studies. Over the years, sleep medicine has been, discussed more frequently because sleep is related to many different disease states and can be, underlying factors to many diseases. In regards to the home health care, I was more or less inspired because I became aware that many individuals would benefit from such services with baby boomers reaching retirement age. But overall, with both organizations, another goal was the motivation to provide not only quality to the recipients that would benefit from the care of our services, but I also wanted to provide a work environment where employees wanted to come to work, learn, and grow with the organization and felt valued.
All right. So did you know from the outset that you would be forming not one but two companies?
I actually had no idea. I couldn't even tell you that it was always my dream to go into something that was even in healthcare. I think what was happening at the time, being just in that arena and working in that arena, I saw a need for, the quality of care, which was being, lacked in so many areas. And I just started asking a lot of questions. And after the sleep clinic took off, as an entrepreneur, sometimes your mind is always racing, like what's going to be your next venture. And after having the sleep clinic for 5 years, I decided to venture into home health.
Great. Now, when starting a company, there are inevitably growing pains. You said your mind is racing all the time. What were some of your most challenging growing pains?
Well, the number one, and something that we still face challenges with today, is hiring the right people and finding workforce talent to fit into our company culture. We have faced the challenge of locating employees who can handle the change, the pace, the pressure, and the scope of our organization. So finding people, I would say, is very hard. And to this day, we are just learning that we must absolutely have a discipline not to hire until we find the right people, because in the long run, what has happened is it has caused us a lot of heartache and pain, not only from a financial aspect, but from a time aspect, and then also limiting the, growth of the company in so many areas. So I would say that would be probably, like I said, number one, growth pain, and we're still, facing, some struggles with that to this very day.
And how do you work with your staff to continue motivating them to say that, stay with me here, we are going to get the help that you need, but, just hold on. How do you work with your staff in those moments?
Right. Well, I think one of the things is that when we do bring people on board, we do, tell them that when they join any of the two of our organizations, it's that they should be getting something out of this as well. So it shouldn't be totally just about the company. So what we believe in doing is doing a lot of cross-training. And so that way people can also see, that they are, growing in different areas. Whereas when they may have started and they may have not been pretty, as proficient in a skill set. And people seem to be more apt to work with you. We definitely let, the individuals in our organization know that they are appreciated. We do have a bonus-based structure for performance. And so with a combination of all of those things, it tends to work out, although it's not always easy at the time because, people quite naturally, just human nature, you do get tired. But we definitely continuously try to enforce and let them know that they are, appreciated and that we are working, as a team.
Of course. This is clearly an area, which you seem very passionate about. Is there anything you might recommend to other people who are looking to, improve their recruitment within their own firm or perhaps down the road? I guess, where did you find your most inspiration when it comes to good, solid recruitment?
Well, I think that someone once told me that sometimes people fire themselves before they are even hired. And so I think one of the things that you have to do is when you're recruiting, and sometimes it's, hard for employers to do, you have to look at the little things. And, sometimes it's even going, with your gut feeling when it comes to something. But another thing is we invest a lot, in training. And so there are a lot of home health organizations out there, and even we have a lot of competition with the sleep. But what we always say is that if they have a certain, the skill set that we're looking for, we're still going to train them the Evolving Evolutions way or the Houston way. So we have a training program that is really set up to focus on key areas where that are vital to the organization.
Great. And then how long is that training program?
It depends on the role that the individual is stepping into. But I want to say the training is ongoing. It's something that we continuously do. So it's not something where it may be, you come in, for a week and you get trained on a computer program, that we may be using. But training is absolutely continuous, and it's vital, if we're going to be sustainable.
Sure, that constant education is critical.
Sure.
Great. Now, let's talk a little bit about customer service. What would you say your approach to customer service is in your companies?
Well, there's several areas I would like to think. We try to be solution-focused rather than being problem-oriented. We also listen to understand rather than making assumptions or being indifferent to the customer. We also try to be very gracious and empathetic rather than being unconcerned or, even dismissive. Clear communication is something that at all times has to happen. Without communication, I think that you're going to have a breakdown in everything. And also being assertive. And then another thing that we do is not being defensive and treating customer feedback as something that is not valuable. So we really value customer feedback from our customers. So with the combination of all those things together, we would like to say that it has really helped us, even differentiate ourselves when it comes to our competitors in the areas of customer service.
Great. And would you say that the time earlier in your career as a pharmaceutical rep, did you develop a lot of your approaches to customer service here, or was it elsewhere during your career?
I would say that it was pharmaceutical did play a role because that's important. But as I, began to really get into working with patients on an everyday basis, it was very important to hear their feedback so that we could make, necessary changes if something was working or if it wasn't working, or even if there was a complaint, how could we fix it? So it was, more or less polished, as, with both of the businesses. But it did start in, pharmaceutical sales and some of the other industries that I had worked in.
Sure. Great. Well, I just have one last question. In your opinion, looking forward, what does the future of healthcare look like, and how will that impact your businesses?
Well, with the Affordable Care Act that we're all aware of, there will be an increase in healthcare coverage. Therefore, more people will be able to receive, necessary care. Also, there will be a growth in outpatient services. Therefore, many people will be able to receive, the services such as, home care and also sleep studies. The downside is possibly not only when it comes to my business, but also, with physicians, is there may be some effect when it comes to the reimbursement. But I see healthcare, being utilized, or more individuals being able to receive the necessary care that they're going to need. And so that is going to really play into, the small businesses such as mine and other independent diagnostic testing facilities and home health care agencies.
Sure. So perhaps more recruitment efforts on your end, I would imagine, or, is there something else more immediate in terms of an impact of the Affordable Care Act?
Well, I think what's going to have to happen, too, is more partnerships with bigger facilities. Perhaps one of the things with the Affordable Care Act is, patients are definitely encouraged to not necessarily be or stay in the hospital for prolonged periods of time. So they're going to want to have facilities such as mine offer, services, outside of the bigger facilities. So, partnerships with, larger hospitals or clinics to work in partnership.
Excellent. Well, Christina, that's all the time that we have for today, but I want to thank you so much for joining us.
Absolutely. Thank you for having me.
Take care.